Good afternoon to what I understand is nearly 800 of you today. My name is Craig Babb, and I chair the American Bar Association's Commission on Homelessness and Poverty. Thank you for your commitment to being part of the legal profession's response to our neighbors experiencing homelessness or threat of eviction during this pandemic. Today's panel, entitled Coronavirus, a Homeless Community Adverse Impact from Eviction and Lack of Safe Housing, is sponsored by the American Bar Association section of Civil Rights and Social Justice and the ABA Commission on Homelessness and Poverty. This panel is one of many in a series of rapid response webinars on the COVID-19 pandemic. We are actively planning additional COVID-19 programming on a variety of issues, so please visit americanbar.org for updates on these programs. I'm delighted today to introduce this program and to welcome James Sandman, who recently concluded his 9-year term as president of the Legal Services Corporation, where I suspect many of you either worked with him or were inspired by his thoughtful leadership. Not surprisingly for a lawyer who, by his own admission, still reveres the lessons learned from his federal judicial clerkship, Jim was the managing partner at DC's Arnold & Porter during his 30 years with that distinguished firm, before leaving Big Law to serve as the general counsel of the DC school system. His list of honors and other commitments is lengthy, but for our purposes today, his latest public service is to chair the newly launched American Bar Association Task Force on Legal Needs Arising Out of the 2020 Pandemic, created by President Judy Perry Martinez. With that, Jim, welcome. And let me begin by giving you the floor and asking what the goal of the task force is and how should ABA entities and all lawyers do to support your work.
Thank you, Craig, and thank you for inviting me to be with you. I'm so glad that so many of you have called into this conference today. The ABA's Board of Governors gave our task force 3 charges. First, to identify legal issues arising from the coronavirus pandemic. Second, to make recommendations for dealing with those legal issues. And third, to mobilize pro bono resources. The task force consists of a total of 37 members and liaisons. The members include the leaders of a variety of ABA committees and sections, such as the Civil Rights and Social Justice section, the ABA Committee on Pro Bono and Public Service, the Center for Innovation, the Litigation section, the Standing Committee on Legal Aid and Indigent Defendants, Disaster Response and Preparedness, the ABA entities whose expertise is most relevant to the current situation. Our liaisons include representatives of the National Center for State Courts, the Conference of Chief Justices, represented personally by Chief Justice Nathan Hecht of Texas, the Conference of State Court Administrators, the Administrative Office of the U.S. Courts, the Legal Services Corporation, the National Legal Aid and Defender Association, the Pro Bono Institute, the Association of Pro Bono Counsel, among others. What we're doing to follow up on the charge we were given by the Board of Governors is 3 things. First, we're looking at collecting, organizing, and curating information, legal information about issues relating to the pandemic. There is a lot of great work going on across the country in many quarters today, but it is being done largely on a dispersed and siloed basis. And although there's great hunger for information and information sharing, people are finding both too much and too little of what they need. Too much in the sense that they can suffer from information overload. When they go searching for information, they can find lots of information in lots of different places, but have trouble sorting through it to find out what's most relevant to their situation, to identify best practices, to come up with syntheses of who's doing what. And too little in that what they might need particularly can be very difficult to find. So we're hoping to function as a national clearinghouse of information that makes it easier for people to access information. You're doing that today. Having a webinar like this that convenes so many people from across the country is a very effective and efficient way of sharing information and making information accessible to people that they might otherwise find hard to access on their own. Second, we hope to disseminate the information that we get in a usable and user-friendly way. We have created a website that has a lot of information already collected. We solicit contributions to the website so that we can continue to expand our clearinghouse function. We're using social media. Commission or task force members and I personally am participating in a number of events like this. We're trying to do matchmaking to connect people who are engaged in related activities to be sure that they know what each other is doing and can learn from each other. And finally, we're focused on facilitating pro bono. Our perspective on the pro bono piece is national. I regard the pro bono work that's most necessary to deal with the pandemic as happening largely at the local level. So we need to be focused and careful about what we can do at the national level. What we can do is bring together national pro bono players, such as the ABA's Pro Bono Committee, the ABA's Center for Pro Bono, the Pro Bono Institute, the Association of Pro Bono Counsel, and the legal services community, represented both by the Legal Services Corporation and by the National Legal Aid and Defender Association. We've established 4 pro bono goals. First, to promote the primacy of legal services providers on the ground legal aid programs in determining what the legal needs are in their communities and how pro bono help can best facilitate addressing those needs, as opposed to having the pro bono volunteers independently decide what they think needs doing or what they want to do. We're encouraging the pro bono volunteers to take their cues from the legal services community. Second, we want to promote coordination among the pro bono bar and not have every law firm or individual pro bono volunteer or bar pro bono program doing its own thing in isolation. We can maximize the impact of the pro bono community if we work together and collaborate. Third, we can facilitate remote pro bono, not remote in the sense that this session is remote, but there are many parts of the country that are under-lawyered, but where there are significant legal needs. And we can do some matchmaking between volunteer lawyers in big cities, often in big firms in big cities, to address the needs of people who are located in more remote areas. And finally, we think there are opportunities to identify national issues on which pro bono volunteers can advocate regardless of their location. That's what we're trying to do. Our role is really a coordinating and facilitating role. And I'm very grateful for the opportunity to participate with all of you today. I encourage you to reach out to our task force, reach out to me personally. I'm currently between jobs and I have thrown myself into this. You can contact me directly by email at james.j.sandman@gmail.com. Or you're welcome to call me. My phone number is 202-494-3455. I enjoy hearing from people all over the country, and I'll do anything I can to help you out and get you the information you need. Thank you.
Thank you so much, Jim. Let me ask everybody, Jim is not going to be able to stay on for the entire program. So if anybody has any questions of Jim now, please ask them now. And while anybody is coming up with that, let me ask you, Jim, is there any particular area of pro bono that has been identified thus far that needs more attention than has been paid thus far?
I'd identify 2 things right now. First, the most urgent need and the largest volume of matters we're seeing is accessing benefits. Particularly on insurance, employment on insurance benefits, and small businesses and nonprofits trying to access financial help. So accessing benefits, particularly low-income people, often need help in accessing the benefits programs, even though the programs may be set up with the intention that individuals can access them on their own without help. They often don't function that way, or often low-income people don't have the tools available, particularly in the current environment, to access them. The second area of pressing needs is wills and advance directives, particularly for healthcare providers who are finding themselves in situations where their health is at risk, their lives are at risk. And if they don't have wills, healthcare powers of attorney in place, they need to get them quickly. And we're trying to facilitate access to those vehicles for them.
You know, it's interesting that you said that, because the Paycheck Protection Program that I think you alluded to briefly, that was established a week or 10 days ago, has already run into some serious problems where banks are declining to participate in the program. And that's another key area where lawyers would be very helpful. Are there any other questions? And if not, we can proceed. If Jim, if you could stay on a few more minutes and if some questions pop up.
Sure, I'd be happy to.
Allie, is this a couple of questions we have here? Let's see. Here's one question. What is being done to ensure that deaf, blind, and other people with disabilities have access to all the ABA is offering, website, pro bono services, etc.?
The ABA is making a number of offerings itself. There are CLEs available that are linked to on the website that we've created. All of the ABA content, as I understand it, is developed with accessibility in mind. And on the website itself, we've tried to limit our links to those that are accessible. Some of our content is created by other people, and I can't say that all of it is as accessible as we would like, but that is a criterion that we apply in identifying what we'll include. It's very much on our minds.
Thank you. We have a question from Claire Mooney. How can law students help?
Law students are most likely to be able to help through their clinics. As I mentioned, most of the pro bono needs that we're seeing are going to be met at the local level, and existing law school clinics are probably in the best position to connect with their communities and find out what they can do. There may be more national things that law students can get involved in, but I expect that the best way to get involved with those would be through existing student associations that are already represented on their campuses.
Is there a website for the task force?
Yes, there is. If you just Google American Bar Association Coronavirus Task Force, you'll be led to it.
I have a question from Lauren Song, a question for Jim. Is ABA coordinating any systemic advocacy efforts related to COVID, or is the focus on meeting the legal needs of individuals?
Both. The task force isn't itself engaged in advocacy efforts. Only the president of the ABA can speak for the ABA, and Judy Perry Martinez is doing that every day. Our website includes links to ABA statements that Judy has issued on a number of matters of importance. If there are issues that you would like the ABA to speak on, you can route them to me or to Judy, and she will take them up with the Government Affairs Office. There are a lot of opportunities for legislative advocacy currently, as I'm sure you all know. Many jurisdictions have issued stays of eviction proceedings, but the length of those stays, the terms of them vary. Some jurisdictions are staying the filing of eviction cases and not merely judicial action on evictions, but that varies across the country. And there is a lot of anxiety and anticipation about what is going to happen down the road when stays of evictions are lifted. and when there may be a backlog of eviction cases and a surge in eviction activity, and how that will be handled is a big issue. So Judy is the spokesperson. I can help in getting requests for statements routed to her.
Thank you. There are a number of other questions that we will answer separately because they really deal with the provision of specific kinds of legal assistance in discrete cases. And that's not really within the jurisdiction of the task force. But for those people who pose those questions, the section or my commission and the staff will provide answers to those either during or after the call. Jim, thank you again.
Sure, thank you, Craig. Good to be with you all.
A couple of housekeeping issues for everybody. During today's program, we encourage you to ask questions of our panelists, as you've just done. There will be time at the end for our panelists to address them. As an attendee, you should see a control panel, which a lot of you have already identified, such as audio options, chat, raise hand, question and answer. For the purposes of this webinar, we ask that you submit your questions through question and answer, not the chat function. If you do not see the controls, please tap your screen and move your mouse to ensure your screen is not idle. We will be sharing a recording of this program to everyone who has registered so that you can share it widely with your network. Please feel free to leave us feedback and questions as we follow up. And with that, I will begin with our other speakers. I'm going to introduce each speaker just before he or she speaks. The first person we are pleased to have with us is Kelly Miller, a U.S. human rights advocate and a U.S. delegate to the United Nations Summit in Geneva 2020, and a volunteer with the National Law Center for Homelessness and Poverty, who is experiencing homelessness as we speak. She will start us off from the street. Kelly.
Hi, thank you, Craig, and hello, audience, and welcome to Ground Zero. You will see people speaking, and they're probably speaking from their homes. Behind me, I have a green plastic. This is what I sleep under each night. May the 1st will be 4 years that I have lived outside here in DC and been exposed. Next slide, please. Been exposed to the elements and homelessness issues. For people who don't understand what homelessness means, it means that you're unhoused. You're exposed to all environmental elements, cold, heat, rain, snow. You're exposed to physical violence, lack of access to sanitation, shower, toilet, food insecurity, isolation, segregation, and disenfranchisement. These are all extreme adversity issues that homeless people are already facing on a daily basis, 24/7. They don't have weekends. They don't get to enjoy weekends. These are issues that they must deal with 7 days a week, 24 hours a day. Next slide, please. So when we have a group of people who are experiencing all these severe adversity issues, and then suddenly we have an outbreak, and that outbreak affects all people, but it's especially going to affect the people who are not housed, who do not have access to things such as shower and sanitation. The CDC recognized this. Next slide, please. The CDC recognized this and mandated certain protocols for the homeless to occur. They stated that they wanted access to sanitation because, as we all know with this COVID-19, it is extremely important to maintain sanitation. The CDC recognized that homeless people living on the streets do not have this access. To shelter in place without harassment, we are not to be moved, we are not to be harassed. To shelter without threat of criminalization, we are not to have police to threaten us because we are experiencing homelessness during this epidemic. And we are to be provided individual housing to shelter in and isolation. Next slide, please. What we don't have access to, we still don't have restrooms. We still don't have showers. We don't have food, laundry, or reliable transportation. The way that DC is set up is that it has all these resources. However, they are distributed throughout the quadrants, so that if you want a shower, you have to go to one corner. If you want food, to another, and so on. However, at this time, with everything being shut down, I can't even buy a membership at a gym to get a shower. This weekend will make 4 weeks that I have not showered. This is happening to all these homeless people, including myself. So the less sanitation availability that we have, the more prone that we are to experience the illness. And as we live in the public, and you that are housed come into the public, you are exposed to us. So it is vital that we get the isolation that we need with housing, with a structure that provides us with access to sanitation. Next slide. So if you don't know anything else after you get done hearing me today, I want you to understand that absence of shelter does not diminish human value. Just because that I live under a piece of plastic doesn't mean that I don't have the same human value that anybody else does. I have a story, I have a history, I have experiences, I have life skills, I have a family, I have things about me that are of value and worthy of sanitation, worthy of ability to fight, next slide, to fight, or end of slides, to be able to fight this virus. So what we need to do is we need to provide what the CDC said needs to be provided. We need to be able to shower. We need to be able to use the restroom. There is nowhere for anyone, not even people who are sheltered, to use the restroom. And when you come to DC and you have to stand in long, long lines to utilize grocery stores and resources to get what you need, especially females, you don't have anywhere to go to the restroom. And it makes it extremely difficult because you have to use it before you leave and hope that you get through your line and get your resources and get home. So I just want people to be aware that it's not just the homeless now that don't have access to restrooms, it's everyone. So when we address what the homeless people environment need, then we can in turn limit the outbreak and the people that are going to become sick because that they were associated in the public with where the homeless are associated with.
Thank you, Kelly. I'm going to change around a little bit how we were planning on doing this, and encourage, if people have an immediate question for each speaker after they finish, I will entertain some of those questions right away so that the question is much more immediate to the speaker who just finished speaking. And Kelly, let me begin one with you. What do you suggest to help people experiencing homelessness during this shutdown? What recommendations would you make that we as lawyers can and could do?
Well, I would love to see you to support the National Law Center on Homelessness and Poverty in their endeavors to secure that we get shelter through hotels, that we get sanitation availability. They are doing a very good job working very hard night and day to make sure that we have this access. But, you know, it takes a village. And the more people that stand up and say, these people deserve this, they deserve these rights. It's inhumane not to provide it. And it's also hurting us as a society because we're not providing it. Then the sooner that we can have this addressed, because as you can see, the CDC made these recommendations over 2 weeks ago and nothing has been done. I have been out in the Northwest quadrant and I've only seen one porta potty that was open and accessible to the public. So we need to address this issue if we want to make the curve go down.
And if you don't mind a more personal question, if you've not showered in 4 weeks, how are you so presentable today?
Thank you. Eric loves this one, don't you, Eric? So I do a little thing called a bird bath. I've been doing it now since 2011. I grew up poor and we had to do the best we could back then. And so I kind of learned how to do it back then. 2 bottles of water can do a lot if you have access to it. It's very difficult for a homeless person to gain access to be able to wash themselves. We don't have privacy. We don't have access to the water. So if you have anything at all that you can give, give some water so that they can. I had a lady give me a bowl that I call a popcorn bowl that I can pour the water into so that I can wash.
Well, you look great, and we're so pleased that you're sharing this with us. And I think that so many of us have a hard time understanding that not just is it inhumane of how we may be treating folks like you and not providing services that are necessary, but frankly, during this virus outbreak, it's in all of our best interests to do it.
Correct.
Are there any other questions right now for Kelly? And we can ask them later on also. If not, let me move on to our second speaker, just referred to. Eric Tars is the legal director for the National Law Center on Homelessness and Poverty. Eric last year helped us here in Montgomery actually ultimately defeat an ordinance that criminalized panhandling. That's no longer the law in Montgomery, although the attitude remains, I'm afraid. Thank you for that, Eric, and he will bring us up to date on national policy issues and advocacy. Eric. Eric, are you there?
He's muted.
I am trying to figure out how to share my screen here so you can see these nice slides that I prepared. But every time I try to start the presentation, it goes away from my Zoom window so that I can't show it both at the same time. If anybody knows how to resolve that. Or I will.
Maybe you can just proceed, and if Allie can figure out some way to be of assistance here, but otherwise.
Yes, I'll get those up as soon as I can. Please proceed, Eric.
All right. Sorry about this. Now I'm stuck. Here, I will quickly send this to you, Allie. My apologies. All right, so that should be on its way to you, Allie. All right. So thanks for having me. So I'm the legal director at the National Law Center on Homelessness and Poverty. And we, as Craig says, have been working at the forefront of serving as the legal arm of the national movement to end and prevent homelessness. The vast majority of our work does get done through pro bono resources. So for example, in Montgomery, we have a team from Latham & Watkins working with us. Every year, our modest budget is multiplied 5 to 6 times by the amount of pro bono legal services that we're able to leverage. So really the way we work is as a hub, and then mobilizing the legal field on behalf of people experiencing homelessness. We are kicking this into even higher gear with the work around COVID-19 because we know that people experiencing homelessness are extremely vulnerable to the disease. We know that even preceding the crisis, that people experiencing homelessness had higher health risks, that they have chronic health conditions that are often untreated. We know that people experiencing homelessness are 44% become homeless after turning age 50. So they're older, which is another vulnerable, subpopulation to the disease. And we know that actually being chronically homeless, being constantly on the streets, adds 10 to 20 years to people's chronological age in terms of their health condition. So even if you are below 50, you might have the health of a 60 or 70-year-old. And again, this is something that just puts people at extremely high risk. And as Kelly was saying, the idea that people experiencing homelessness can stay at home in these times is absurd. They don't have a home to stay in. They don't have the ability to wash their hands or take other hygiene measures. And even those who are sheltered, they are, almost by definition violating the CDC guidance to not congregate in groups of more than 5 or 10. All of these things lead to extremely high vulnerability. Studies have shown that homeless individuals who are infected by COVID-19 are twice as likely to be hospitalized, 2 to 4 times as likely to require critical care, and 2 to 3 times as likely to die than the general population. And so, as Kelly was saying, again, this isn't just about people experiencing homelessness. If you want that hospital bed to be available when you need it, when your mother needs it, when your brother needs it, then it has to be kept available by preventing a homeless person from going there first. So it's really in everybody's interest to make sure that homeless people are given the best services immediately, because they are so much more likely to require that ICU bed, that ventilator, than other people. This is an investment that will pay off 2 to 4 times over in the availability of beds down the road. And that is why we were very proud that we were able to get the CDC to issue guidance a couple weeks ago now that specifically says unless individual housing units are available, communities should not be clearing encampments during the community spread of COVID-19. And so that is the main message. People experiencing homelessness should be put directly into hotel units as soon as possible. If they cannot be, then communities should be encouraging spacing of tents if it's possible, and ensuring that nearby restroom facilities have functional water taps, or that they are provided with other sanitation stations, porta potties, things like that. But really, at this point, that's the guidance for people experiencing unhoused homelessness. But even those in shelters, they should also be immediately being transitioned into individual housing units. This federal guidance from the CDC has been adopted at the state level by the state of California. If I could share my screen, I would be showing you a nice flow chart that they have, showing a bunch of different options. Is somebody already in medical care? Are they in a shelter? Are they unsheltered? And all of the options kind of point to, none of them point to putting people into congregate shelter. They all point to the best thing to do is get people into individual housing units. HUD has also issued guidance on this that is a little bit softer, but definitely emphasizes the best practice approach is getting everybody into individual housing units, and then has kind of steps down for different subpopulations. Oh, great, there's the slide. So I'm on slide 5 now. Yep, there we go. So we were able to get this guidance put into official CDC guidance from the top public health authority in the country, and we thought, great, we got this guidance. Every community should start following this. Next slide. Can you move on to the next slide? The next step, of course, was that communities objected to the potential cost of this. And so we sought to address those cost concerns through the Federal CARES Act. Allie, can you advance? Looks like we're stuck. But so the Federal CARES Act has $4 billion of new emergency services grants funding for HUD service providers, $5 billion of community development block grants, and $150 billion of general community relief funds. And all of those are potentially able to be used for putting people into housing. There was also in one of the previous bills, $45 billion of FEMA funding. And we've seen from several communities that they are saying they can't, that because of various FEMA restrictions, they can't use the funds in the way they would want to house people. Those should not be looked at as restrictions at this point. All of these new funding streams are now immediately available, even if the money itself has not filtered down to local communities. They have, the CARES Act says you can get reimbursed for anything back to the beginning of the crisis that you are doing to address COVID. So people can, everything is designed to spend the money now, get people safe now, and then proceed into to getting the reimbursements. Most of the restrictions and caps on different aspects of using the funds have been waived. And there's no procurement requirements. You don't have to bid things out. You can get people into housing now. And so that should be the message going out to every community across the country. Another positive aspect of the law is that it requires that no prerequisites be imposed on individuals experiencing homelessness in order to be able to get access to services. Recently, from the federal level, from the Trump administration, we've seen a kind of push back against the principles of housing first, just getting people into housing, and towards a more paternalistic kind of approach that uses housing as an incentive in order to be able to access the services. So you have to go through certain programs or do other activities in order to be able to get access to the services. In this funding stream, none of those things are allowed. It's just designed, everybody should be able to access the funding immediately. Unfortunately, we see across the country that communities have not all gotten the message and are either still putting up, haven't taken any steps. Some are still doing sweeps of homeless encampments. Some are continuing to put people into congregate shelter. Some are continuing to enforce parking laws that penalize people for trying to live in their vehicles and tow away their vehicle, put it in an impound lot, and then that person is out there on the street with no shelter. So we are calling for moratoria on all of these sorts of practices and instead putting people, as I said, into housing. The one other thing I want to mention is that all of this obviously has a disparate racial impact. Homelessness is disproportionately experienced by people of color. While 13% of the population nationally is African American, the homeless population is 40% African American. And Native American individuals are also twice as likely to be homeless as their numbers in the general population. And so because of those things, because of the other health inequities and housing inequities that we see in the community and economic inequities, we know that all of this is going to have a disproportionate effect on people of color, and therefore that the solutions need to have an equitable element to them. So we have put together a number of recommendations that are on our website, including stopping the sweeps, not putting people into congregate shelters, making sure that people can be housed in individual housing units, hotels, motels, trailers, RVs, etc. If they can't, making sure they have access to hygiene and sanitation services, putting a moratorium on the vehicle ticketing and towing and impoundment, and then immediately and safely decreasing the number of people who are already incarcerated under these ordinances criminalizing homelessness, who are in these jail cells that are again by definition almost contradicting the CDC guidance. Using surplus governmental property as places where people can either safely camp or be provided with housing, and then preventing new homelessness by immediately halting all evictions and foreclosure proceedings, as is happening in many communities across the country, halting the termination of utility services to people who can't pay for them, and making sure that everybody has access to resources and other protective gear. In order to be able to help communities do this, on our website at nlchp.org/coronavirus, we have a template letter that has our letterhead on the top of it, but an opportunity for local organizations or individuals to put their own letterhead. And you can go through and just kind of insert all your local facts. What is going on locally? Are there sweeps still continuing? Are people being put into congregate shelters? And then it has kind of all this legal information and policy information about what the CDC has said, what the CARES Act provides, and comes to the kind of point that people need to be put into individual housing units now. So if you are a local attorney and you want to help and you're wondering what you can do, this is an action you can take. You can find a local homeless organization that might want to partner on this and help them to put in their information, help them to draft it, do it on your own if you are already part of a organization, or as part of your local bar, you could do it, and call on local officials to get people into housing, and all of that. And there's a template press release that goes along with it. Again, this is all available at nlchp.org/coronavirus, and you can get the word out to your local media. We really see that communities need to be shamed, unfortunately, on this. We have seen some important victories. Baltimore, for example, has already put 200 people, put them on buses, took them straight to a Hilton and put them into rooms. That is exactly the kind of thing we're looking for. The state of Connecticut has issued an executive order directing all local agencies to start putting people into housing, emphasizing that these are reimbursable expenses. So that's another step that attorneys can be taking, can be working on taking some of this language, which we have on our website again, and encouraging other state leadership, other city leadership to kind of give local service providers the go-ahead to start incurring these costs immediately with the knowledge that they will be able to be reimbursed. Unfortunately, we do see challenges out there. The weekend that the CARES Act passed, rather than figuring out how they were going to spend these new CARES Act dollars and get people into hotels, the city of Las Vegas, which currently has 150,000 hotel rooms, mostly sitting vacant, spent the weekend painting lines on a parking lot so that homeless people could sleep 6 feet apart. The city of San Francisco has, despite strenuous advocacy by local advocates, spent time, spent energy, spent resources setting up a large convention center with mats on the floor and folding chairs with lines, again, on the floor 6 feet apart. So wasting resources, wasting time on these solutions that the CDC does not endorse, rather than just focusing on how can we get people into housing as quickly as possible. So the Law Center is working on legal challenges to these sorts of approaches. We're looking at federal constitutional theories. some under our case Martin versus Boise, which many people may have heard about, which states, if you can see my t-shirt, that if there isn't an alternative place where people can go that is cruel and unusual punishment under the 8th Amendment to punish somebody for needing to undertake a basic life-sustaining activity like sleeping or sheltering oneself in public when they don't have any other place that they can do that. So we're looking at, is a congregate shelter, when the CDC says it's not an appropriate public health option, an adequate alternative. We're looking at theories under the 5th Amendment and 14th Amendment for whether or not that, people who are already in kind of custodial settings or congregate shelter settings under the force of law because there's a legal threat if they go out and camp on the streets, is there a state duty to ensure their bodily integrity, to ensure their health? We're looking at federal statutory claims under the Americans with Disabilities Act in terms of making sure that people have access to services that are appropriate for their disabilities, which is a highly overlapping population with people experiencing homelessness. We're also looking at state constitutional and state court common law theories, such as state created danger, writs of mandamus, looking at whether or not who can enforce public health codes, for example, against the state if the state is not following its own guidance and the guidance from the federal government. Can we sue to make sure that they are doing so, or if they are continuing to tow cars and in the midst of this, are there challenges that can be made so that people can be put directly into housing?
Eric, if you want to wrap up about another minute or so, because you've got a number of questions that have come in.
Sure. To wrap up, the one most important thing that you can do right now is you can go to our Housing Not Handcuffs campaign website, housingnothandcuffs.org, and endorse the campaign. That'll get you onto our email list, and you'll be able to see these activities as they are going on across the country and look for opportunities to get involved. We'll keep you up to date with limited email updates and things like that. Also, check out our Housing Not Handcuffs resources there, which give you talking points and other things, sample legislation and research. And you can join our Housing Not Handcuffs Justice Network, which is just attorneys who are working on these issues, looking at legal strategies. And finally, as Kelly said, you can support the Law Center, nlchp.org/donate. We as attorneys aren't doctors. We can't save lives in the way that they do. But I can tell you, with all, appropriate humility, that the work that we have done to get the CDC to issue this guidance and have started already getting people into housing, this has saved lives. We are saving lives as attorneys by getting the right policies in place, getting those policies implemented so that people experiencing homelessness are not going to die from this crisis. But as I said earlier, so that other people don't die because our healthcare systems won't be overwhelmed by the extremely vulnerable people experiencing homelessness who would be in those beds or who won't be in those beds when we need them. And we at the Law Center are doing this on a shoestring budget, and we need your support to continue helping us do that. So please donate if you can, and sign up for our email list, and so we can help direct you to the best way that you can help.
Thank you, Eric. I had mentioned to you just before the call, and let me mention it to the audience as a whole, when you talk about congregate situations, just before we went on the call, I heard that a federal judge had declined a motion to release some of the people in the Cook County Jail. And the statistics there as we speak are that 400 people are diseased, 300 of them are incarcerated, 150 of them are people who work there who will leave the jail and go home at night. And so that it can't be much more congregate than that. But there are a couple of other questions let me pose to you here. Somebody wanted, Kimberly Peterson wanted the link to the HUD guidelines that was just shown. That will be on the overall program that we're going to save, or we can send that, or we can send it out to you.
The chat box as well.
Okay. Miriam Childs, Eric, in New Orleans, I heard that the hotels weren't staffed adequately with medical personnel and CDC guidelines weren't being followed. Could you address this issue?
I haven't heard that specifically. Obviously, we do, you can't just put people into hotels and then leave them there. You have to make sure that they have access to adequate nutrition. We definitely see this as a win-win for a lot of communities where the hotels are sitting vacant and hotels have been begging for a bailout. And this is a way of, supporting the local hotels for paying for the rooms, but also potentially employing their hospitality staff so that they can be preparing meals and doing those sorts of things so that people can get access to them. Those are potential, you can't ask them to do the same duties that a staff person for a shelter would do, but they can take off some of the burden of, distributing the meals and things like that. That's, it's really disturbing to hear that they haven't been adequately staffed. And that we are trying to get more funds right now into the 4th federal package. That's one more thing that people can do is call your congressperson right now. There's a push to get $11.5 billion into the next bill for homelessness specific funding, as well as $350 billion for eviction prevention for people who aren't yet homeless, but could become so. So call your congressperson, call your senator, and tell them to make sure that those funds do get into the next package.
Thank you. Okay, I have a question from Josephine McNeil, who was former chair of the Commission on Homelessness and Poverty. And she asked, does separate housing include renting blocks of hotel rooms only during the length of the virus? What happens when the virus declared over?
Yeah, that's a great question. At the moment, yes, but we are already, encouraging people to look beyond. So some places, for example, in California, they are working on coming up with plans for, what do we do for the 90 days that, we have this initial funding for? What do we do on day 91? And how are we using this opportunity, this investment of funds to actually plan for the long term? So instead of renting a floor of hotel rooms, we've seen some communities buying hotels. And so those hotels presumably will be, a community resource thereafter. And that's a good way of addressing the problem. The state of California is also buying, these retired FEMA trailers and things like that. So those are resources that will be available after the fact. And, looking at manufactured housing, other, housing that's easily put up, that could definitely be, that is a use, an eligible use for the funding. So if you can transition the funding, once you have people immediately off the streets, I think, we can't let anything delay us from getting people immediately off the streets. and we can't let communities give us any excuses about why they can't get people off the streets. It's what the CDC says they should do. They have the money accessible to them. People need to be off the streets now. Every day that they delay is a greater danger to the community. But once those people are off the streets, we should definitely be looking like if you can purchase a hotel, if you can get access to other vacant property, and use the COVID relief funds to fix it up, to make it appropriate for people to live in, and then transition people in month 2 out of the hotels and into that new facility, then that is definitely something that communities could be doing. And again, that could be a resource for the long term. My goal is that no person should have to leave a hotel and go back to the streets. We should use this to get everybody permanently housed.
Eric, this is really for me. Was there any provision in the act where funds were provided to help bail out the hotels, that they would have some obligation in return, certainly with money, to house these folks? In other words, is there any leverage in there to do more than just ask them to help out?
No, we fought for that, but ultimately, the agreement that the leadership came to was that the kind of corporate support dollars would be fairly unrestricted. So that was our goal, and my kind of statement on this, which doesn't have the force of law but can certainly be used for shaming purposes, is any hotel that took public dollars, their rooms are now public housing that should be used for the public good. If you want our taxpayer dollars, then you need to do something for the public good in return. And if you aren't, then shame on you. But no, unfortunately, there's no legal requirement there.
Is there any thought about trying to get it in the 4th piece of legislation?
Yes, it's definitely something we are continuing to fight for. Yeah.
There are a number of other questions that I'm going to have to answer offline because we need to move ahead. There's some very good questions here and some observations, including one dealing with FEMA trailers. And I would, having gone through Katrina, just note that, as you said, some of those are being purchased or used, but they also had formaldehyde problems in them, and they're not appropriate for long-term residents unless they've been cleaned out. But I don't know the answer to that question right now. Eric, thank you so much, and we're going to move on now. And please stay with us because we can get back to some of those questions. Joanne Pania is the Director of Policy and Advocacy at the National Network for Youth. She is going to share with us some of the particular issues dealing with youth and how best to serve youth during this pandemic. Joanne.
Sorry, I was on mute right there. Hi, everyone. My name is Joanne Paano, and I'm the Director of Policy and Advocacy at the National Network for Youth. Thank you so much for this opportunity to speak with you all regarding the impact of COVID-19 to youth and young adults experiencing homelessness. And so I'll just tee up the PowerPoint there on the screen. Hopefully folks can share it. A little bit about our organization. We are a membership-driven policy and advocacy public education organization, and we're made up of about 300 local service providers, agencies, and young leaders with lived experiences of homelessness. And so we collectively advocate to address and solve youth homelessness through policy, practice, and partnerships. Our membership currently is working across the country steadfastly as frontline workers. And so just wanted to share a little bit with you all about the specific subpopulation of youth and young adults. As you can imagine, they are at high risk of infectious diseases already in their mobility and instability, and facing even higher risk given the current pandemic. And since self-isolation and self-quarantining into such transient situations continues to pose such threats and challenges for many of these youth, young adults, and young families, resources are urgently needed in local communities across the country. so that organizations such as youth service providers can provide some of the critical and life-changing services, including access to safe and stable housing, medical care, and access to basic needs such as food and hygiene. I think COVID-19 has really highlighted why having definitions of homelessness in the law and in policies that take into account the unique needs of youth are crucial, and so that more youth, young adults, and young families can become eligible and seen as also a priority for services. To give you a sense of how many youth and young adults experiencing homelessness are in this country, on any given year, there's about 4.2 million. And when broken down by age, that's about 3.5 million 18 through 25-year-olds and 700,000 13 through 17-year-olds experiencing homelessness throughout the country. Homelessness can take place in a variety of settings for youth and young adults, from street homelessness, doubling up by couch surfing, living in abandoned buildings, living in short-term shelter, as well as long-term shelter programs. I wanted to share a snapshot with you of what our membership looks like and the type of programs that are actively serving youth and young adults throughout the country. And I won't read it into detail, but you'll see on your screen where we have basic center programs, street outreach programs, and transitional living programs, which includes maternity group homes. We've been hearing a lot from our membership in terms of their limited budgets, staff capacity, stretched resources in terms of how they're trying to reach more and more youth and young adults as the numbers of clients entering shelters and through their programs is increasing because of the pandemic. And in an effort to work closely within our partners and some of the work that they have been leading on the ground, we've been keeping the lines of communication open. So to be able to listen to and hear where the greatest needs are, including where there are legal challenges. As the National Network for Youth, we've been hosting what we've been calling weekly office hours, as well as webinars with our partners in the education space to really understand in detail what is unfolding and where there are legal barriers in serving youth and young adults. So for those who are currently experiencing homelessness and those who have returned as clients because of episodes of homelessness. And you'll see on the screen what we have been hearing in terms of community needs is a clear understanding of policies. This was mentioned earlier, and there is a lot of information guidance coming out from the feds, from organizations, from the media. And so just trying to get a clear understanding of how organizations and young people with lived experiences of homelessness can access resources is something that we're hearing. At the organizational level, we're hearing that funding, resources, and staff capacity is of huge needs. And as we're focusing on clients' needs, of course, it boils down to access to resources and basic services. And so as we've been hosting these facilitated conversations with our communities and local service providers, there have been certain specific issue areas that have been coming up, and that's outlined here on the screen for you. A lot of information has been coming out related to COVID-19. So you'll see four main bucket areas that continue to pose challenges. 3 of these are directly connected to clients, so those youth, young adults, and young families who are experiencing homelessness. And these include tax implications around the eligibility and dispersal of stimulus checks, unemployment insurance benefits through the CARES Act, as well as housing-specific questions as it applies to landlord and tenant law. And then the final major theme that we're hearing from the field is around nonprofit operations. You can imagine, just like any other business, local nonprofits are fighting to stay afloat with limited budgets and resources and more clients entering their doors. And so I thought it would be helpful to just kind of dive into each of these areas to give you a better understanding and also to identify where the legal questions and issue areas are per theme. So just starting with the stimulus checks and the tax implications, both eligibility and filing processes are an issue that we're hearing as challenges, especially for youth and young adults who are considered to be legal dependents as defined by the IRS. So questions that we've been hearing include, what if a parent or guardian files for the stimulus on their own, but that parent or guardian doesn't have a relationship with that youth or young adult? We've been seeing rejections through TurboTax and that young people are not able to go through with the actual process because they're being claimed as a dependent Social Security number. And those are the words that we have been seeing from youth and from our partners across the field. Other gray areas occur when the young person hasn't filed taxes in the past and they don't have a steady flow of income. Some other questions relate to immigration status, as well as those who are disability recipients. And so understanding the different challenges around receipt of the rebate is something that we are hearing a lot of. And so there is the confusion in terms of eligibility processes, where to go. And so we've been having these ongoing conversations with our service providers and with our young leaders to get a better sense as guidelines are being issued by the feds in terms of where to go and who to turn to. And I think just understanding some of those tax implications, as well as the fluidity of current situations with unemployment, qualifying and applying for unemployment insurance through the CARES Act is something that we are receiving a lot of questions from the field. Many of the youth and young adults in this population work in the gig economy and in lower wage jobs. So with retail and restaurant industries closing one by one, we have been hearing about a lot of clients who are losing what would ordinarily be a somewhat steady income for them. Added to that, those who typically receive resources such as food, transportation from schools are also limited in what they are able to access. And so we know that the US Department of Labor recently issued guidelines regarding insurance coverage, specifically through the Pandemic Unemployment Compensation Program, as well as the availability of the Pandemic Unemployment Assistance Program, which really is that catch-all for many of the runaway and homeless youth that we and our service providers do provide services to. There are again questions regarding eligibility and application processes, as the situations do differ from client to client, and then there may be even challenges in obtaining and gathering documentation with regard to payroll stubs. And so I think by focusing on these two areas of where we've been hearing a lot of challenges, you can imagine that this underscores the need for youth who are experiencing homelessness and who are trying to access services to the best of their ability. And then moving on to the next portion, where we're hearing a lot of housing law specific questions, specifically when it comes to landlord-tenant law. There are a multitude of concerns around children, youth, and families accessing safe and stable housing. So as more and more shelters, more and more states have been under shelter-in-place settings, we are hearing that this is especially troublesome for young adults, youth, and young families who are currently doubled up and who are couch surfing. And you know, many of them have been kicked out of these homes because of the concerns around the shelter-in-place program. And then when it comes to specific housing questions that are coming out from communities, some questions have arisen, such as whether landlords can or cannot charge late fees. While we know that families haven't received eviction notices just yet, I think it was alluded to earlier in that the moratoriums are in place, families are starting to receive non-renewals. So questions as to whether this will apply to the expiration of the family's lease and what are their options, how will motel evictions take place, if at all, for these families, are a lot of the questions that we're receiving. And so you can imagine that there are a lot of areas of need for legal services pertaining to some of these questions. Some of the other areas that we've run into include whether extensions will be made to rapid rehousing clients and whether emergency solution grants can be used by communities to house those clients. Are there eviction protections in place for undocumented clients? So again, running into some of those immigration related issues, not only in the eligibility and receipt of stimulus checks, unemployment insurance, but also for housing related issue areas. And so again, this just underscores that within the scope of housing law, there are a range of overlapping issues that a lot of nonprofit organizations, such as youth service providers, are running into as they are seeing clients every day. And then lastly, moving to nonprofit operations, in order to continue to provide services, to continue to staff. It was mentioned earlier, Craig, you touched upon the payment protection program. And so we are hearing from nonprofits who have already started the process of applying and are running into issues of misinformation from the lenders. We're also hearing that there are early challenges from local nonprofits relating to whether or not they can even apply. As there have been guidance, not guidance specifically, but excuse me, there have been instructions from the SBA as to what can be included for applications. There is this confusion at the state and local levels when applying for some of these loan forgiveness programs, particularly the payment protection program. And then folks might have seen earlier, there was an interesting article that was published in the Chronicle of Philanthropy, which reported that a lot of nonprofit organizations across the country are outlining their fears and concerns over overwhelmed bank websites. We know that the eligibility criteria, again, has been shared, but it appears that lenders are just trying to issue as many loans as they can with limited resources themselves and with limited information. And so we have been receiving questions regarding eligibility criteria, and we've been trying to stay abreast as to some of the updates that are coming out with the feds and sharing that information with our members as well. And in addition to 7A loans, some of the other questions for nonprofit organizations have come around operations specifically, and when it comes to client consent and confidentiality. Some of our members have started to resort to virtual mental health services. And so what are some of the guidelines when it comes to HIPAA protections in some of those situations, knowing that this is a very fluid situation? I did want to share with you all a story that came from one of our service providers in Virginia, who shared that we have seen an increase in the loss of jobs for our clients as smaller restaurants fear they will be closing down soon. One client with 2 children lost her job as her employer isn't staying open, while another was laid off and given $300 along with her final check. Clients are also losing one of the few ongoing supports in their lives, so for food, transportation, counseling, and other resources from their schools. Because clients can't afford to stock up on items, they are running really low on things, and we've essentially started rationing out supplies. Youth in need of jobs have put their job hunt on hold, and the loss of jobs, postponement of job training programs, and the inability to get new jobs has greatly impacted our clients. While this story comes out of Fairfax, Virginia, this is similar to so many of our member providers and communities across the country, in that they are strapped for resources, they are on very tight budgets, and they are just fighting to keep their doors open, the lights on. And so in terms of what folks can do and in supporting some of these nonprofit organizations and some of the youth and young adults who are experiencing homelessness, we do encourage folks to share your knowledge and expertise in some of the above mentioned areas. And feel free to visit our website. I'll go ahead and type that into the chat box for folks, and just share resources that really can explain what some of the federal legislation has created as an impact through the CARES Act, so that more and more states can understand how to utilize what is within their reach. And just to kind of wrap this up, I did want to share a quote from one of our young leaders at the National Network for Youth, Benjamin, who mentioned, "We all continue to face our own individual hardships, but as youth with lived experiences, we have the advantage of recognizing how far we have come and grown as individuals and leaders. The sense of panic and the fear of the unknown are all too familiar, but we have overcome those circumstances before, and we can overcome this too."
A great way to conclude, Joanne. Thank you so much. We are going to move on, but we can come back with questions for Joanne and you can post them. Let me remind everybody, unless you're simply sending out a statement that you want everybody to see, please post questions on the Q&A. I would now delighted to introduce Rob Robinson, who's a staff volunteer for Partners for Dignity and Rights, which was formerly National Economic and Social Rights Initiative, a human rights organization based in New York City. Rob is also experiencing homelessness and will share his perspective from the street and how that relates to what needs to be happening with the virus. Rob, welcome.
Just a little trouble unmuting. So thank you, everybody. I appreciate the opportunity, and thank you to everybody at the American Bar Association. And in particular, I want to lift up Kelly and Eric, 2 folks I've worked with for a long time. And Kelly and I have had many stories about sharing your own personal story. I know sometimes it's difficult for folks like us who have been formerly homeless, but to change narratives, it's important that we share our own personal stories. So as I go through this, I will share part of my personal story, but I'll also share the work that's going on in the ground in New York City and other places around the country with respect to COVID-19 and coronavirus. So for myself, doesn't seem to want to move. Okay, so you see who I am. My name is Robert Robinson. I'm formerly homeless. I spent 2 years on the streets of Miami and 10 months in a New York City homeless shelter. And that process, I like to say, was a transformative experience. And why do I say that? Because I was taught certain things in my life. I learned certain things in school. And then I actually lived. I had a lived experience of living on the streets for 2.5 years and living 10 months in a New York City homeless shelter. And that changed my perspectives on the world. So I learned from that experience that it was important, the importance of sharing my lived experience, encourage others, as I just said to Kelly, to share their personal experience. It was an opportunity to change the prevailing narrative. You're homeless because you don't want to work. You're homeless because you have an alcohol or chemical addiction. You're homeless because you don't have an education. I went homeless with a degree from the University of Maryland. I went homeless after working 35 years. Don't have a chemical addiction or an alcohol addiction. So we need to change narratives. I realized early on my lived experiences of mine and others could shift policy, and it led to a surprise advocacy and teaching career in my post-homeless life. I bring this up because Neil Smith, who you see on the screen, was a distinguished professor of geography and anthropology at the City University of New York. And in 2007, I was on a panel around affordable housing at Columbia University, and I made the following statement: gentrification leads to displacement, which leads to homelessness, which leads to criminalization. As I went through what I went through, it seemed there was a predetermined path for some people, and mostly, as Eric and others have mentioned, folks of color, African American, Black and brown people seemed to be, that was the predetermined path for most of those folks. So my history of advocacy, I started with a group called Picture the Homeless, of which the National Law Center has a long relationship with, and Eric and I have been working together for the better part of 10 years. I spent 12 years as a voting member on the steering committee of the New York City Coalition on the Continuum of Care. And that position gave me access to New York City appointed and elected officials at the highest levels. And that was a space to do some incredible advocacy. So there was a question that came up earlier, Claudia asked, and she asked about the legal force of the CDC. Maybe not a legal force, but as somebody who has access to high levels of New York City government, when you receive a document like that or a link like that from the Law Center, I have a tool for accountability, right? Okay, New York City, this is what the federal government is saying. You might ask, well, how does that move New York City? Well, New York City, through this continuum of care, gets about $120 million every year in McKinney-Vento funding. So if you don't act upon these CDC guidelines, then maybe the next time I go down to DC, I have a nice little conversation with the USICH, HUD, and some of the other folks that are involved in that agency. That given access again through the Law Center. So people with lived experience are able to advocate at very high levels and levels that people don't often think about. So in New York City, COVID-19 and homelessness, New York City has 550 shelters with a population of over 50,000 people on a nightly basis. Mark Scheidberg asked a question about hotels. Yeah, we're advocating you hear a little bit more about hotels, but if you ask to put people in hotels permanently, is where New York City started, it ended up at 550 shelters and a shelter industrial complex. So it's somewhat problematic. So I said there are 50,000 people a night in shelters. Those numbers have hit as high as 65,000 in the last 2 years. There's an estimated 50 to 100,000 people that are living doubled up with family and friends, and the remainder are street homeless or living in public spaces. New York City Department of Homeless Services has an annual budget of $1.5 billion. An estimated $2 billion comes in from philanthropy and foundations, and then another $120 million in McKinney-Vento funding. Close to $4 billion a year to warehouse people in shelters. So the whole philosophy in New York City is somewhat problematic. So it stands to reason that there would be a problematic response to COVID-19 because there's a history of problems dealing with homelessness in New York City. So as an advocate, I found the following statements of problem: shelter in place, stay at home. I'm speaking to you from an office in the financial district of Manhattan, where every morning when I came into work on a regular basis at the Fulton Street subway station, there were 4 residents in there on a daily basis, right? So what happens to those folks? How do they shelter in place? Do they stay in that public train station where they can't space themselves out from 6 feet? It's problematic. It's a problematic statement from the word go, unless you have an alternative for those folks that are sleeping in public spaces. Stay at home, they have no home. So how do they stay at home? So both these phrases were problematic, which made some of us across the country start to share information. When I say across the country, we went as far as the Western Regional Advocacy Project on the West Coast, which organizes homeless folks just like groups in New York do. And again, the Law Center has supported, on both coasts. So how do we advocate and organize in this moment? Well, we reach out to advocates from across the country, as I just stated. We gather protocols and information from the federal government. These agencies included the Center for Disease Control, Housing and Urban Development, and Health and Human Services, right? That interaction or the relationships with the U.S. Interagency Council on Homelessness gives you access to folks at a high level in those positions. They will easily send you the information that you request. We ask for support from the UN Special Rapporteur on the Right to Adequate Housing. Leilani Farhar put out her mandate as an international expert on housing and unsheltered folks, right? You never hear the term informal settlements used in the US. People sleeping in tents in San Francisco are part of informal settlements. So US government, how do you handle informal settlements which you claim you don't have? These are questions that we can demand from the government and force them to answer in a situation where there's an emergency and they have to answer. You demand COVID-19 protocols from state and local governments, and you confirm the information is being distributed to shelters. So I said there were 550 shelters in New York. A bunch of us as advocates started asking the shelter providers, what are your protocols? Oh, we've received no guidance from New York City. That turns us around to say who governs these particular shelters? Department of Homeless Services, Department of Social Services in New York. You sit down, you start to flood their inboxes with the guidelines from the CDC and force them to distribute their own set of guidelines. New York City turned out a 5-page guideline in about 48 hours. Something Kelly mentioned that is a little bit problematic in New York City. The guidelines from the CDC said, yeah, there should be public toilets, but New York City is too dense and populated for that. The better idea for us was to access hotel rooms, right? That you have these vacant hotels all over New York City. The very first one to close was a hotel in the middle of Times Square, Manhattan, that has 1,200 rooms. Boom, in the center of the city. So the Marriott Marquis in middle of Manhattan was one that we first started recommending to the city to reach out to.
Bob, if I could interrupt for just a second. We're running a little short on time, and we've got one more person. So if you could wrap it up, and we'd like to James.
So
thank you.
Again, many of our appointed and elected officials often are guilty of talking about a problem versus finding a solution, right? This pandemic required an immediate solution. Distribute materials to street homeless folks and those in shelters as requested by the CDC, put street homeless people in vacant hotels. And in New York City, as of this gathering, there are 1,000 formerly homeless street people in 4 hotels. This morning, New York City signed off on a 5th, and they're talking to signing up 5 more. So hopefully by the weekend, we'll have 10 hotels online where street folks can go. A group of different organizations in New York City are organizing, and you can find a lot of information on this website called homelesscan'tstayhome.org. There will be a big action in front of a well-known hotel in New York City tomorrow, saying if people aren't put in hotels, they will die. So I thank you all for the opportunity, and I look forward to Q&A.
And thank you, Rob. And people can still be asking questions. I want to get to, we're going to run over a little bit, but if that's okay with everybody, this is just really a good discussion. Finally, I'd like to introduce James Heaton, who is a supervising attorney with Mission United Veterans Pro Bono Project. supportive services for veterans families, legal aid services of Brevard County, Florida, and an active member of the ABA Commission on Homelessness and Poverty, who will talk about what lawyers can do now and particularly with focus on veterans. James.
Thank you, Craig, and thank you everybody else, and thanks for the people that stuck around. I appreciate it, and I'll try and be brief here. So really my role as an advocate and direct service provider here in South Florida is connecting homeless, impoverished, and at-risk veterans with pro bono attorneys in the community to help with a variety of civil, administrative, and military-related legal issues. Our focus has changed slightly, as you can imagine, over the past few weeks to address the need over the pandemic of COVID-19. And I want to share with you some of the efforts that we have undergone in order to help address these needs. Now, really our focus from the beginning, and something that I can share with all of you as something you can bring back to your communities, is first by identifying the resources that are available to you in your community. For example, we have a pretty robust bar association here in Broward County that we can engage our private attorneys at, just front facing. Also throughout the state, many of the counties throughout the state of Florida have private bars, and I'm sure in your communities that there are private bar associations in conjunction also with many legal aid programs. Legal aid programs are a great place where a lot of the pro bono resources are housed. So being able to connect with those legal aid service providers, if you're not already working with them, connect with them now. I guarantee you that they're working to serve the same populations that you're trying to serve as well. And just the private bar in general, and other resources that you would commonly find in your community. And hold on as I mess with this screen a little more, so I'm still trying to learn technology. So really, some of the aspects that we've identified that I want to share with you, and they're things that are common throughout many of the populations that you serve, and some of the topics that were discussed earlier, so I'm going to be very brief. But I want to set it up really with one thing, and this is one of the big barriers that we see here in Florida, is the landlord-tenant laws and evictions. And right now, Florida has a moratorium on evictions through the court system, which is great. The moratorium states essentially that it's suspending and tolling any statute providing for an eviction cause of action under Florida law. However, here's the catch: solely as it relates to non-payment of rent by residential tenants. The problem that we're facing here is that it doesn't protect from evictions based on the expiration of term of lease. It doesn't prevent based off of alleged violations of the lease. So this is a problem that we're starting to see, especially it's April 9th right now. Rent was due about 9 days ago for most people. So we're starting to see those questions pour in. We're also starting to see landlords harassing, if you will. Maybe it's not legal harassment at this point yet, but threatening tenants with eviction regardless of the moratorium. And that's probably the number one issue we're seeing for housed veterans at this point, is landlords calling them saying, hey, you didn't pay rent. We are moving forward with the eviction. I don't care what the court says. And so we're getting a lot of calls from veterans about what they can do at that point. Now, for our unsheltered folks or our homeless veterans, we're experiencing some unique difficulties there as well. For example, currently, I was just speaking with the director of our SSVF, one of our SSVF providers in Miami-Dade and Broward County, and they've informed me that essentially all but one of the shelters have shut down for new admissions. However, they've been able to utilize the SSVF, which is Supportive Services for Veteran Families, dollars to house homeless veterans in hotels. So they've been very fortunate. They've had at least a few hotels through both counties that have been willing to accept those dollars to house veterans, at least temporarily. And they're also still working with landlords to fill vacant properties, but it's a continuing issue that we've been experiencing. Now, reaching homeless folks has also been a challenge, as many of the normal resources that we use, normal locations that we use have shut down. or have really limited their contact with with folks. So public spaces such as libraries where we hold clinics, where we hold outreach events have shut down. So we really are relying on the boots on the ground, the folks that are out there, case managers that are out there in the streets, contacting and connecting with homeless folks to bring them to the services or bring the services to them that are available. From our SSBF provider, they've informed us that the focus has really been connecting the unsheltered folks, folks experiencing homelessness with just a safe place to be. And that's their focus is, they said they've had a fair amount of success with family reunification. It works for some, but as I mentioned, hotels and other temporary housing have been what we've had to rely on at this time. We're somewhat fortunate in Broward County to have a smattering of resources available, and that's really what we've been using. Now, I want to briefly talk on some other issues. They've mostly been discussed, consumer issues revolving around debts and debtors' rights, and also the idea of having not-for-profits apply for these loans under the CARE Act. Again, we've been engaging our private bar, and we found a consumer law firm that has come on board and said, hey, any homeless folks that you have, any at-risk veterans that you have, the veterans not necessarily being homeless, we will provide them with a full evaluation of their consumer rights, and if needed, we will help them file for bankruptcies if it's appropriate. And they're willing to cover all the fees there as well, which is amazing. And they've also come on the other side and have offered their support for helping not-for-profits and small businesses navigate the funding aspects of care. Now, we've been working again with the private bar and developing trainings based on what we're expecting to see downstream for that are expected to be anticipated to be pertinent legal issues and another crises once the courts open, one of them being the amount of evictions that are going to be filed. I don't think anyone else here, and probably no one else in the chat, lives in a state that has the laws like Florida does, where it's pay to play for evictions. If an eviction's filed against you in Florida and you don't have the rent that they're saying is due, and you can't post in the registry, you don't get a defense, you don't get a hearing, you get an eviction. So we're asking right now as a point of advocacy to see what we can do in Tallahassee to temporarily amend that law, or hopefully permanently change it, which is something we've been fighting for since the dawn of time. And it's now more than ever that there's a huge need and unfortunate reason to leverage these times to hopefully get some legislation passed at a state level. More so, one of the other things that's important that we're doing as well is engaging employment law firms to help educate our populations about employees' rights, but also employers' responsibilities during these times. So we've had some success there. There's actually a pretty well attended, I think there's about 170 people on this webinar earlier today that was hosted by our local bar association. So there's a lot of interest in that, probably because people are just sitting at home, not much better to do, but it's been a good opportunity for us to engage those folks. Tax implications as well. One of the things that Joanne pointed this out, and that's the filing of back due tax returns and the implications. We were discussing earlier on a phone call about the implications, immigration impact, and some of the poor information that's going around right now. We've been told that some of these folks that are experiencing homelessness that haven't filed tax returns, that may not be engaged with Social Security, are being told to file tax returns, but they have to claim income is what they're being told. And so they're being told to just file, self-employment income of whatever amount of money they want to write. Well, that clearly is wrong and not good guidance, and also has other implications for Social Security and potential immigration impacts down the line if a person were to file federal tax returns stating that they have self-employment income when that's not the case. So we're planning on continuing to identify these pressing issues, both things that are going on right now. I'm sorry, I'm kind of rushing through this to be mindful of your time, but also the downstream issues of what we're expecting to see once the courts reopen, once life starts to return to some sort of normalcy, and always continuing to engage the private bar and to assist those folks in need, and work with our local circuit and state legislation to develop solutions and points of advocacy and policy. And I just want to, one last thing, give a quick shout out to the Commission on Homelessness and Poverty. I've been a member of the commission for the past few years now. And if you're looking for certain COVID-19 resources, we have them available on our website. Go ahead, take a look. The website is ambar.org/homelessness. And as always, the commission's happy to provide technical assistance and help find answers to your legal questions, whether they are local or national questions on representation or policy. So happy to help. Thank you very much for this opportunity.
Thank you so much, James. And thank you also for the plug there at the end. We have a number of questions that I didn't pose, as well as some comments and questions on the chat space. We will respond to all of those, as James said, either somebody on the commission or the staff or the section, and we will get that back to you. We're a little over, but I think it's been worth it. We hope you've learned from and were energized by this presentation. I was a member of the ABA while in law school and remain so today. If you were not an ABA member, let me suggest that if you still remember why you went to law school, then join the American Bar Association so that we can continue to do the kind of programs we're doing here today and throughout the outbreak so that we can help as many people, homeless and otherwise, who are being affected by the virus. Thank you all of our co-sponsors who are listed on the program invitation. Thank you to the wonderful panelists we've had today, sharing their knowledge and expertise in this time of great challenge. I particularly want to thank the staff that has just worked day and night to put this and other programs together. Ali Kielsgaard, Kelly Russo, Sally Huker, Paula Shapiro. You do wonderful work, and we couldn't be here without you. To all, be safe, wash your hands, and be kind. Thank you very much. We're adjourned.